Hi, everybody. Good evening and happy Wednesday. Thank you for joining us for our Arthritis Talks on smart strategies to manage joint pain and stiffness. My name is Sean Brady. I'm the Vice President of the Arthritis Rehabilitation and Education Program and Innovation at Arthritis Society Canada. And while we have come together for this event from many different places, I would like to acknowledge that the land on which I am located and on which our Toronto office stands is the traditional territories of the Mississaugas of the Credit First Nation, Anishinaabe, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis peoples, and I'm grateful to have the opportunity to live with my family and work on this land. Living with arthritis can make even the simplest daily tasks feel challenging, but small changes can make a big difference. Tonight, we are very fortunate to be joined by Lauren Macgillivray, an occupational therapist from our arthritis rehab education program in Ontario, who will share her tips on how to make everyday tasks easier. Now, before we get started, there's a few logistics I want to run through with you. The webinar is best viewed on a laptop or desktop computer. If you have any technical difficulties, please email Arthritis Talks, all one word, at arthritis.ca for assistance. If you have a question for our presenter, Lauren, you can submit it through the Q&A button at the bottom middle of the screen, and we will try to get to as many questions as possible during the hour that we have together today. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants and our chat moderator as well. If you would like to close the chat completely, please click the X icon to close out the chat window. To enable closed captioning, please click on the show captioning icon in your controls toolbar at the bottom of the screen. So many questions were received in advance that followed similar themes. So we are going to try to address those before going into our live question and answer period at the end of today's session. Now, before we get started, I also wanted to thank our event partners, including Pfizer and others for their financial support for our Arthritis Talks series. Now let's get started. A very warm welcome to today's expert, Lauren Macgillivray, occupational therapist from Ontario. Welcome, Lauren. So many people on this call have arthritis, obviously, in terms of the interest in this session today. Could you get us started by elaborating on why arthritis can make tasks so challenging?
Yeah, thanks for the intro, Sean. I'm happy to be here. Thanks for having me. So to get a better understanding of why arthritis makes everything so challenging, you need to understand the basics of what arthritis is initially. So we'll just do a quick overview of the different kinds of arthritis and the symptoms, the common symptoms that you'll see associated with it. So arthritis is an umbrella term. It can break down into two different categories. One being osteoarthritis. That's the most common kind of arthritis. That's the one that most people are familiar with. And then we have inflammatory types of arthritis. Those ones are associated with autoimmune disease, the most common being rheumatoid arthritis and psoriatic arthritis, as well as many other kinds. The difference between the two is that osteoarthritis involves a wear down of the cartilage and the tissues within a joint. And inflammatory arthritis is an autoimmune disease that involves an immune attack on the joint lining that creates swelling and inflammation. So because of this, they're managed a little bit differently in terms of medication and what your doctor may recommend. But many of the strategies in terms of daily living tips and lifestyle strategies can be applied to both kinds. But that's just something to keep in mind. Depending on what kind of arthritis you have, your symptoms may look a little bit different. So delving a little bit deeper into what's actually going on inside of your joint. When you look at a joint that is unaffected by arthritis, there's two bones that come and meet. to form the joint, and then lining the ends of those bones where the joint meets is the cartilage lining. That's the protective lining that allows you to move that joint and have it slide smoothly. And usually, if you don't have arthritis, that movement will be relatively pain-free. When you develop osteoarthritis, the middle photo there, you can see that you start to lose that protective lining. That cartilage lining thins out, the bones start to sit closer together, and in response to that, your body starts to build up bony tissue. The surface of the joint may become more rough. And then on the far side, we have now a joint that's affected by inflammatory arthritis or rheumatoid arthritis, and that can look a little bit different. The area of the joint that's typically affected with rheumatoid arthritis is the fluid lining, also called the synovial lining, that goes around the entire joint capsule. And typically, that fluid would provide nourishment to the cartilage, which helps keep it healthy and move and glide smoothly when you're moving. When you have a flare-up of an inflammatory arthritis, the immune system attacks that fluid and causes it to change its properties and become inflamed. So it's no longer nourishing to the joint, and then it causes symptoms like swelling, heat, pain. So understanding kind of what's going on inside the joint, that gives you a better idea of why arthritis can cause so many different symptoms and have an impact on your day-to-day living. So we can kind of group these symptoms that you may experience into different categories. There's the physical symptoms, obviously, such as pain being the most common. I'm sure many people can relate to that. And then there's also stiffness and swelling, maybe visual changes to the joint, such as bony enlargement or angle changes, instability or looseness of the joint. When you take into consideration all of these physical changes, that can really add up to functional problems, maybe impacting your ability to participate in daily activities like working, caring for yourself or others, even socializing, maybe even sleeping. And lastly, even though arthritis, it's a physical condition, it can impact you beyond that as well by impacting and causing emotional changes, such as frustration, depression, anxiety, fear of the future. Those are all the common things that you'll see, and they all go into impacting how you go about your day-to-day life in one way or another. And here are some numbers on the screen that have been pulled from a recent national arthritis report. And they really go to show how common it is to have difficulty with daily activity and daily movement when you have arthritis, regardless of what type.
Great. Thank you, Lauren, for that overview and background on arthritis, the types and the symptoms. I think a lot of people on the call today are really interested in managing arthritis. So could you dive in to what you would recommend for people to manage their arthritis?
Yeah, we can delve into that more deeply. There's many things and strategies that you can apply to treating arthritis and managing it and helping live a better quality of life. You can categorize treatment of arthritis into two areas. So there's medical management, which involves treatment or help that you get from healthcare providers. So that would be possibly medications that are recommended by a doctor or a rheumatologist, for symptom control or disease management, but it can also include things like considering joint surgeries when appropriate. And then we have the other realm, which is self-management. These are strategies that you can learn to implement into your own lifestyle as a way of managing your arthritis. Self-management, it's a really important concept with chronic disease, and it's defined as having the skills and the confidence to manage your arthritis on a daily basis and its impact on your daily life and roles and emotions. So it can include all of the topics that are listed on the screen. Kind of a cornerstone of self-management is education, which is why we did a bit of an intro at the beginning. But we're going to focus more in on ways to protect your joints and modify activities that may be difficult or painful for you to do with your arthritis. So what are some ways to do this? You can kind of lump these into more broad categories, and then we'll go more specific by joint in terms of strategies that you may find helpful. But we call this generally activity modification or joint protection strategies that you can apply to activities that you're having trouble with to help not only protect your joints, but manage pain, conserve energy, and potentially even help prevent further arthritis progression. So, for example, ask yourself, what's more important? Is it to use up energy by struggling to open a lid with your bare hands? Or would you prefer to save your hands for something that's more meaningful to you? So, examples of just generally how you can do this. Maybe you want to focus on applying some type of external support to your joint to support it, which we'll talk a bit about later on. Maybe there's a type of device that you can use to lessen the force on your joint during a certain activity or help you perform something more easily. Can you simply change the method by how you do an activity, potentially by using your body to do that in a bit of a different way? And also things as simple, they sound simple, but this is what people struggle with the most, is just learning how to actually pace yourself properly so you're not always pushing yourself into pain, and learning how to prioritize things that are actually most important for you to get done so you don't overload your joints on a bunch of things that are really not that important to you at the end of the day.
Okay, great. Thank you, Lauren. That was a great overview, I think, of the key principles. And as you mentioned, in the slides that we'd get more specific, and I think we did have a lot of questions about specific joints or challenges that people face. So could you provide some specific recommendations for those on the call that have arthritis, specifically in their hips and or their knees?
Yeah, that's a good starting point, Sean. So something that's very common for people to have challenges with hip and knee arthritis is walking. You need to do walking, whether it be for exercise purposes or just your day-to-day activities. It's an important movement that you need to do. So what are some ways you can take some of the pressure off those hips and knees and make it more comfortable? Again, just starting with pacing yourself. So check the amount of time that you're walking for and what time your symptoms start getting worse, and see if you can modify the amount of time so that you stop yourself and take a break before you get to that point where you're doing too much. Can you walk in areas where they have options to sit down and take breaks? Can you pace yourself in some type of way that's different than what you're doing now that's causing your pain to increase. Some people may also consider gait aids. So gait aids are tools to help you walk and take pressure off of your hips and your knees to relieve pain, but also to optimize alignment. So if you walk with a limp, then you may want to consider talking to a healthcare provider about if a gait aid would be a good option for you, because it can really help normalize your walking pattern, take the pressure off of those joints, and help you be able to walk longer distances. Some people are hesitant to include these in a treatment plan, but it's something that you can also just use on an as needed basis. So maybe for when you're having flare-ups, you can have it on hand, or you can just use it when you need to walk longer distances. So maybe use it when you go out shopping, but walk without it at home. And then we have walking poles. So this is in the bottom left-hand side. These are a bit different than a gait aid, like a cane or a walker. They're more of an exercise tool. Some people may have heard of Nordic pole walking. That's a very common exercise that's recommended to people who have hip and knee arthritis, because the poles allow you to walk more comfortably while offloading, taking pressure off of the hips and knees. And it can also help with balance concerns if you're kind of unsteady on your feet when walking on uneven ground. And then we also have a consideration of adding in some type of brace or knee support. These may work for some people, may not be good options for other people, but it is something, again, that can be considered for use on an as needed basis if your knee needs extra support when walking. And then for standing, that can be another thing that puts a lot of excess pressure through the hips and the knees. So anytime you need to stand for a while, think about ways to get creative and change up that activity to take some of the pressure off. So can you alternate sitting and standing? Can you, if you're sitting for a long time, can you stand up and change your positions frequently? Stiffness will get worse the longer that you're not moving, the longer that you're sitting for. So try to stand up every 20 to 30 minutes or so. What's on the screen there is an example of a sit-to-stand desk. If you work at a desk job, this is a good option to keep your positions changing frequently. Spend some time working sitting, spend some time working standing. And then the other picture on the top there is an example of someone using a counter height stool for offloading the hips and the knees when you need to prep things at counter height. So instead of stopping and going to the couch and taking a 5-minute break, have a counter height stool nearby you that you can pull up and sit on, so that you spend maybe 10 minutes prepping standing. Then when you need a break, pull that stool up, spend some time prepping in a sitting position, but you're still able to reach. And then another thing that you can commonly see with hip and knee arthritis is stiffness, or maybe even pain that prevents you from bending over and reaching your feet. So in that case, consider using things like long-handled devices, like a shoehorn or a sock aid, a tool that helps you pull your socks on to help you with lower body dressing. And then for sitting, again, this can be a problem for people in terms of stiffness if you sit too long, but especially with hips, it can cause some pain if the hips being compacted for too long in a sitting position. So consider trying to raise your seat height up so that your hip level is a little bit higher than your knee height when you're sitting. That will open up your hip angle and help with hip comfort, discomfort when you're sitting for a long period of time. You can also use things like furniture risers, and you want to make sure that you're supported well when you're sitting. So look for a chair with a good back support, add cushions if you need to, and always sit with both feet supported flat on the floor so that you're in good posture and you're not putting excess pressure through any areas. And then if you're having difficulty standing up, this is where those higher seat heights come into play as well. So if you really have to push off with your hands to stand up, consider raising up your seat. So can you get a firm cushion? Again, can you get something, what's shown in the top of the screen there is a raised toilet. Toilets are made pretty low. So if you don't want to replace your whole toilet, you can get a seat that's raised that just goes right on top of it. You also want to consider the form that you're using when you're getting out of a chair, because if you're using improper form for daily movements, that can also cause a lot of irritation to the hips and the knees. So you can see in the picture there, the photo of the poor technique where the knees are caving in together. There's a crooked line between the knee angle, the hip angle, and the foot angle. Ideally, you want to try to line everything up. Keep your knees right over top of your feet. Keep your feet about hip width apart. And really use your legs to stand up instead of pushing with your arms. Okay, and then driving is another time where we have to sit for prolonged periods, and it may be another place where you have trouble getting out because some cars are very low to the ground. So when you're getting in and out of a car, again, think of your posture and your positioning. Try to sit down first with both feet on the floor. And then after you're sitting in the chair, that's when you can try to shift and bring your legs in rather than trying to step in first and then sit down. It's also helpful, again, if you have a lot of maybe pinching pain in your hip or discomfort in your hip with driving, try to sit in a bit of a recline so that your hip angle is about 100 degrees instead of a straight up and down 90 degrees. And then when you're getting out of the car, try to slide your seat all the way back so you have extra room. Rotate to the side, put those feet flat on the floor. And then once your feet are stable on the floor, then try to stand up. Don't try to step out with one foot at a time. And you also want to make sure that if you're driving for longer distances, just pace yourself and try to take breaks so you can get up, move around, get rid of that stiffness.
Okay, good, really good overview for the hip and knee joints. What recommendations could you provide for people with arthritis in their ankles and their feet?
Yeah, there's lots of things that you can do for ankle and foot arthritis as well. Walking, again, another area, same thing as the hips and knees, may be troublesome for people with concerns in this area. So lots of the similar strategies to walking with hip and knee arthritis apply to walking with foot arthritis as well. You can use those gait aids, the canes, walkers to offload those painful feet if you're walking with a limp. You can use those walking poles as well to take some of the pressure off of the feet when you're exercising. Footwear is a really big consideration with this area of arthritis. We'll talk about that a bit on the next slide. But getting a good base of support in your footwear is essential, not just for foot pain, but if you have arthritis in other areas of the chain as well, getting a good supportive pair of shoes can help quite a bit. So many people struggle with footwear, and it takes a long time, especially if you have arthritis changes in your feet, to find a pair of shoes that's going to fit well, be comfortable, and support you well. So be patient in the process. It can be a bit frustrating sometimes, but knowing a few good supportive features to look for can really make a big difference. So when you have a good fitting shoe, it optimizes alignment of all those structures that need support when you have arthritis. And it can help a lot with pain. It can also help preventing further progression of arthritis. So key areas to look at when considering a supportive shoe would be one, and if you have a shoe nearby you, you can kind of grab it and look at it if you want to compare. The sole of the shoe, so the bottom, where the rubber part is. And then the heel of the shoe, so the back heel cup of the shoe. And then third would be the toe box of the shoe, so where the forefoot, the toes fit in. So some easy tests that you can do to your shoe to test its supportiveness in those areas. To test the sole of the shoe, simply take your shoe, hold it up, see if you can bend it in half. A little bit of give is normal, but a good supportive shoe will be pretty rigid. If you can fold your shoe right in half, that's likely not giving you the support that you need. You can also try holding it up and twisting it and see how much twist you're able to get out of that shoe. Same thing, a little tiny bit of movement is okay, but a good supportive shoe will not twist very much. It'll resist you in that movement. And then a way to test the supportiveness of the heel, look at the back of your shoe, where your ankle sits in, and then see if you can squeeze the back of that heel together. It should be, again, pretty firm. It shouldn't collapse in at all when you push on the heel. And then lastly, looking at the front, the forefoot of that shoe. For the toe box, you want it to be very wide and rounded. It shouldn't come to a narrow point because that's going to squish the toes and not give them enough room to work and do what they need to do. There are other considerations with footwear, but those are just some good tests that you can do to your own shoe, areas of starting points, or something that you can do quickly when you're going out and looking for footwear. But keep in mind, even with a supportive shoe, with all those features, some people may still require additional support and help beyond that, especially if you have lots of bony change going on in your feet or more severe arthritis symptoms. You may want to consider also doing an additional orthotic insert inside of that shoe. And those can be purchased off the shelf from stores. They can also be made custom. It's very individualized and based on your own needs.
Okay, thank you, Lauren, for that overview of the hip, the knee, the ankle, and the foot. Now let's move into the upper extremity. And I know a lot of people suffer with arthritis in their hands. So could you provide us with some recommendations for people who struggle with arthritis in the hand joints?
Yeah, absolutely. And in my experience, the hands seem to be the most commonly affected area overall, especially when it comes to functional concerns. You don't realize how much you use your hands and how much they do until they start hurting and bothering you. But there's so many things and so many strategies that you can apply to help. We'll just overview a few common categories, but there's still a whole other realm of things that you can do. One of the most common complaints is difficulty with gripping. Maybe you have decreased strength, maybe you're dropping things, maybe your hands are too stiff and you can't make a full fist to get a good grip. Maybe it's painful to forcefully grip something. So anytime you're having a hard time getting a grip on things, look at the handle that you're using and see if you can make any adjustments to it. So can you get a larger handle on it? If your tool doesn't already have a large handle on it, can you add a wider handle? Can you use some type of foam tubing or tape or piping insulation to wrap around that handle and make it larger, make it more padded and easier for you to get a good hold on? Or can you repurchase utensils that have wider non-slip handles built into them? You also want to consider the material. So if things are slipping out of your hands easily, look for something that gives you a little bit of extra grip, like a non-slip material or something that has some ridging to it that's not as slippery. Built-up pencil grips are helpful for that. Lots of people have trouble with knobs, either that's on a door or a tap. So you can get something called a knobble. It's a non-slip grip that goes around knobs to give you a better grip on things. And then you also want to consider using braces. So, and this will vary based on the kind of arthritis that you have in your hands, but maybe you need to consider something like a thumb support, a wrist support, or finger support, depending on the impacted joint. And these can also really help to stabilize a painful joint when you're gripping so that you're able to do those tasks more comfortably. Another common gripping concern is holding things for a long time. So you really want to try to minimize prolonged holding as much as possible. Think of if you can use a stand to hold it for you. Can you use a hands-free device, like if you're talking on the phone? Can you use a headset instead of holding that? Can you use dictation or voice to text instead of using your hands for that? And opt for lightweight tools when you can, so that you don't have to use as much force to grip. Another very common thing that many people have trouble with is opening things. I'm sure many people can relate to that, especially jars. So devices are your best friend for these types of things. Even if you can still do it, but it's becoming harder for you, it's better to get started on using a device before it becomes more of a problem. So consider using devices that have long levers or handles. There's an example of a jar key on the screen. So that's a special tool that breaks the seal on new jars. And it also helps to get underneath of the lid of things like containers to make it easier to open. There's also long-handled jar openers. Consider using levers on door handles or knobs as well, rather than a round knob, because a lever is always easier to open things with, and it requires less gripping with your hands. And when you're looking at the different types of openers, Non-slip grips are pretty universal. Many people have those in their kitchen already, and they work okay for some things, but you still have to use quite a bit of grip strength with a non-slip grip. You may need something a bit more heavy duty for those trickier lids, like an actual jar opener. So a V-shaped one, the middle picture there, those are pretty universal. They can fit many different kinds of and sizes of lids. You can also get that in a cabinet mounted version that you just mount under your cabinets and you lift and twist. Pretty easy. And you can get battery operated things as well that just do it completely for you. All right, and lifting can obviously be another thing that people with hand arthritis struggle with. You want to try to think about how you can modify things so that you avoid heavy lifting when possible to protect those small hand joints from excessive force. So instead of lifting something, can you push it or pull it instead? Pushing is ideal because it uses your larger joints in a more efficient manner rather than when you pull something, all that force goes through one arm and through the fingers. So pushing versus pulling rather than lifting can save you a lot of grief with your hands. Same thing with sliding. If you're, say, cooking and you have a heavy pot, can you put that on a fabric cloth or a pot protector and with oven mitts and slide it across the counter instead of lifting? Can you use wheels? So if you're doing yard work, can you use something like a wheeled cart or a wheelbarrow? Can you put your groceries into a wheeled cart instead of lifting and carrying? With bags, can you, again, use larger joints to carry that bag instead of picking up with your fingers? Can you loop bags over your arm, your forearm, or your shoulder? And try to think about distributing weight as well. So there's going to be less force on your hands if you carry things closer to your body when you're lifting and carrying. And try to distribute as much weight as you can. So always lifting with two hands rather than one. And going back to a pot example, if you need to lift a heavy pot, try to get the other hand in an oven mitt and scoop underneath of it so that you're lifting with two hands instead of one. And activity planning and doing repetitive things with your hands. Maybe it's typing, maybe it's gardening, maybe it's things like crafting. People have a hard time planning and prioritizing for these types of things. Some people think that they have to quit those types of things because their hand hurts. Some people think that they just need to push and push and push and get things done regardless of how their hands feel. So these are some ways that you can think about those activities creatively so that you can still do them in your routine, but you're not always aggravating your hands so much to do them. And this is where prioritizing and pacing comes in. So always start with planning. Think about what you need to do and try to plan for varying your tasks and spreading heavier things throughout the week, even on a day basis. If you have a heavier hand task, try to offload it and take a break with a lighter hand task and vary tasks back and forth like that. So you're changing your hand position often, you're changing how much load is going through those hands so that they get some break. And you also want to think of rest breaks as well with pacing. So every 20 or 30 minutes, especially if you're doing repetitive things, you want to even give micro rest breaks, even if it's just a minute rest to those hands or longer breaks so that they have time to recover and then go back once you're feeling better and complete it. So you want to think about not pushing to completion all the time, but being okay with resting your hands before they get too sore, even if that task isn't completed yet. It's a hard thing to do, but it can make a big difference in the long run. And using timers or reminders on your phone, even if you have a hard time with pacing and planning, is a really good tool to get you in the habit of doing it. So set timers if you're doing something repetitive to give you a reminder to take a break.
Okay, great. Thanks so much, Lauren. I think that concludes the main part of the presentation. But before we get to questions, I always like to ask, as you know, someone who's worked in arthritis for a while and as an occupational therapist, what excites you about the future of arthritis care and for those diagnosed with arthritis? What excites you about what's coming ahead in terms of the future?
Yeah, this is always a great area to talk about. And even in the last few years, there's always advances in arthritis care. So the future for treatment, not just medications, but also things like access to care, medical procedures, helping to improve those self-management strategies to help people better manage arthritis on a day-to-day basis. All of the technology that we have available to us now, it really puts us in a good spot to help Canadians who have arthritis. And that's why it's so nice to be a part of an organization that's really working to advance arthritis care for Canadians. We play a really big role in this process through funding research that then goes into advancing treatments and recommendations, knowing what works well, knowing how to prevent arthritis from getting worse. So I'm glad to be a part of the organization that's helping to bring that to the plate for all of us in Canada.
Great. Thanks so much, Lauren, and thank you again for sharing your expertise today. And I would echo your sentiments about all the great work that's happening in terms of future-focused innovations and research to help people with arthritis, which we're quite excited about. A lot of questions came in tonight, and we do apologize if we can't get to all questions because there were an abundance of questions. But I will start, and maybe we'll do some rapid fire here, Lauren, just to try to get through as many as we can in the next 15 minutes. But I thought I would maybe start with exercise. There was a lot of questions about exercise and confusion around, you know, is it safe for arthritis? When is it too much exercise? Could you maybe just give us a quick overview on exercise with arthritis?
Yeah, for sure. That's a pretty hot topic for people. And everyone has a different experience with arthritis. Some may already enjoy it and have found it beneficial for your arthritis, but some people may also have that negative association with it or maybe fear of it from past experiences like increased injury or risk of injury or soreness. But it's important to remember that the benefits of exercise will always outweigh the risks of it. And it's very safe for anyone, no matter what kind of arthritis, what stage you're at, to exercise. You just may need help with modifying it so that it's most comfortable for you. And there's many benefits to not just your overall health, but your arthritis as well. Exercise, it can improve your joint health, it can improve pain, fatigue, function, it reduces all the risk factors, some of the risk factors, like lifestyle risk factors associated with arthritis, like inactivity, muscle weakness, and excess weight. If you're having a hard time getting started with exercise, that may be a good time to see a professional to help you either get started on a personalized plan for you or help you get comfortable with starting.
Okay, great. Thank you. Yeah, like they say, motion is lotion, right? For the joints, for sure, in the right amounts.
Exactly.
A few questions around navigating, like where to get care. So if somebody, suspects they might have arthritis or they do have arthritis, where is the best? What would your advice be for getting assessed and treated?
Yeah, that's a good question as well. And many people aren't sure how to get help if you suspect that you have arthritis. Maybe you've developed symptoms that you think could be arthritis, but you're not sure. We do actually have on our website, it's a screening tool. It's called Arthritis Symptom Checker. It's a series of screening questions based on common arthritis symptoms. Then at the end, it summarizes all of your answers and it can be downloaded or you can print it off and then bring it to your healthcare provider to have a good discussion about what your concerns are. If you do suspect that you could have arthritis, you'll want to bring that up with your primary healthcare provider. So that would be your family doctor or maybe a nurse practitioner. They'll start by assessing your joints and possibly running further tests to see if arthritis is the underlying cause of your symptoms. In some cases, if they suspect maybe an inflammatory arthritis could be in play, they could refer you on to see a specialist, such as a rheumatologist, for further help in that process. But that's not always required for all types of arthritis. A good starting point is just checking in with that primary healthcare provider and advocating for yourself to get looked at further and see what your options are.
For sure. Okay, thank you, Lauren. Another question around, we had a lot of questions around hands. So maybe I'll ask a couple of questions and you could maybe do a summary.
Yeah.
One is around arthritis gloves. So, are they indicated for arthritis pain? Are they helpful? Other questions specifically around activities. Two activities which seem to be hot topics tonight are people who are passionate about knitting and questions about knitting needles, and another questions around pets and dogs, like walking dogs with leash and hand arthritis. So maybe those sort of three questions around arthritis gloves, knitting needles, and maybe leashes for dogs, and maybe any other final advice you can provide for people that have hand arthritis.
Okay. Yeah, so starting with arthritis gloves, those are a very common tool that many people try to use to manage hand pain. They are essentially compression gloves. They fit snugly around the hands and the fingers to compress the joints and in theory help with pain. We call this like a passive way of managing pain. So you apply something to your joints for short-term relief. These can be a helpful tool when used in conjunction with more effective strategies like exercise and activity modification, because they can help with short-term pain relief, but you want to pair them with those more active strategies if long-term symptom management is the goal. But many people seem to like the feeling of compression, similar to how many people with arthritis like the feeling of heat. And then for things like knitting, there's many ways that you can modify knitting. Pacing is always a good starting point with people, just modify the amount of time that you spend on it. There's also lots of tools that you can add to your knitting toolkit to help you, like wider handle knitting needles. There's also, I forget the exact term of it, but there's stands that you can get to hold and support your knitting needles for you. If you just look up online adaptive devices for knitting, that will give you some good ideas. And then for walking a dog, you can definitely see how that forceful gripping, especially if it's a puppy, probably pulling quite a bit, can put a lot of extra force and cause pain in the hands when you have arthritis. So looking back at those strategies that we talked about, there's probably a couple of things that you can apply to that. If you can pace yourself, so take shorter, more frequent walks so you don't have to grip the leash for as long. Can you do like an off-leash dog park so you don't have to have the leash in your hand as frequently? Or looking at changing up the device. So changing what kind of leash you use. Can you use something that's like wider, maybe a non-slip material like a rubber instead of a slippery fabric, or even a waist tie leash so that it can be hands-free when you're walking the dog.
Okay, great. That's a great overview. Thank you. I know we covered, and there's so much to cover in an hour. I know we covered the hips, the knees, the feet, the hands. A lot of questions around neck, shoulder, and back. So wondering if you could give us maybe some quick overviews on, any quick tips on managing, pain in the neck related to arthritis, shoulders, and lower back pain.
Yeah, and yeah, those are good questions as well. So many of the strategies that we talked about today can be applied to those types of arthritis as well, especially the walking tips for hips and knees, as well as the standing tips, the bending ones, and then the driving ones. Those are all pretty relevant to back arthritis and neck arthritis as well. So a really big focus with those types of arthritis is also incorporating like postural awareness type things. So paying attention to the posture that you put your neck and your back in when you're doing your everyday activities, and looking at ways that you can optimize your spine alignment so that your spine is protected and comfortable for those everyday activities. For example, when you're sitting, make sure you have a good back support in place so that you sit with everything in alignment.
Great, thanks, Lauren. A few questions around falls and falls prevention. And maybe if you could just comment on preventing falls and any advice you can provide for people on the call around preventing falls and staying mobile but safely, like within the home and outside the home.
Yeah, for sure. So, especially with lower body arthritis and with aging, falls can be a thing of concern. And lots of times, falls will happen when you're going from one position to another, such as from sitting to standing, or maybe you're walking on an uneven surface or stepping off of a curb, coming down from the stairs. So before you do those position changes, such as before you stand up from sitting, you want to make sure you're prepping your joints. Like Sean said before, motion is lotion. We get very stiff after you haven't been moving for a while. So think about prepping yourself for standing. Can you march your legs up and down while you're sitting in the chair? Can you bend and straighten your knees? Can you circle your ankles to get the stiffness out and get the circulation going? And then make sure, again, your feet are planted flat on the floor. Take yourself to the edge of the chair. Have your knees aligned right over top of your feet. And then stand up from there. If you know that you have a gait aid like a cane or a walker, make sure that's always nearby you when you're sitting so that it's there for you to grab onto once you're standing. Also take a second before you start walking to kind of give your, not just your blood pressure, but also your joints time to get acquainted with being in a standing position. And especially if you are walking with a limp or you know that your balance is off, uneven ground is going to be a big risk factor for falls. So that would be a big consideration for maybe using something like a cane or a walker when you are walking on those kinds of surfaces.
Okay, super helpful. Thank you, Lauren. You mentioned products, right? We mentioned some adaptive sort of products. You mentioned going online potentially for some, which obviously is sometimes a really great way. Could you provide us with maybe some other ideas of where people can purchase products and assistive devices that help with arthritis? And also not only where you can purchase them, but maybe what to look out for, like what's a scam and maybe, maybe not as effective versus like the tried and true type of devices that are used to help people with arthritis.
Yeah, for sure. So good reputable places to look for devices are things like home health stores, either chains or lots of communities will have their own locally owned home health stores. Those are the places that sell things like walkers, canes, wheelchairs. They'll also have aisles of assistive devices that you can look through. Drugstores and pharmacies will also have limited supply of those types of things, maybe not as good of a selection of the as the home and health stores. So those are always going to be your best bet. It's a little bit harder to look online if you're not used to shopping online, but things you want to keep an eye out for is people who market things like 100% guaranteed to cure your arthritis, things like that, guarantees that they can't back up with research. We'll always want to give you a clue that maybe this product isn't completely legitimate. And if you're not sure, you can always ask on things like our arthritis line. We do have a call-in number on our website where you can call in with questions about your arthritis. There's people on there always willing to answer any concerns that you might have.
Yes, that's a great resource. Thank you, Lauren, for mentioning that. One last question. We have 1 minute for one more question. Just quickly around morning stiffness. We had a lot of questions around strategies in the morning. If you could just maybe give a quick overview of how people can best manage that morning stiffness.
Yeah, for sure. And I think next to pain, stiffness is probably one of the more common symptoms with arthritis. And everyone will likely have some type of morning stiffness. It might be a little bit longer if you have inflammatory arthritis that's in a more active state. But when you don't move for a period of time, that rough surface of the joint, it loses lubrication. And that's why, again, they say motion is lotion. With arthritis, you need that gentle back and forth movement to get fluid, lubrication, blood supply to that cartilage, that joint surface, to get rid of that stiffness. So effective strategies for helping with that in the morning is trying to plan in your morning routine for range of motion exercises. So that would be gentle back and forth movement, such as sitting on the side of your bed before you get up and bending and straightening your knee a couple times in a row. Again, you're pumping that lubrication to that stiff joint. And heat in combination with your range of motion exercises can also help lessen stiffness, whether that be a hot pack that you put on your joint, or some people even just like hopping in a hot shower in the morning.
Okay, great. Thank you so much, Lauren. And thank you again for sharing all of your expertise today. We really appreciate it. And that does
Yeah,
end
you're welcome.
our session in terms of the presentation and the questions. But before we sign off, I would like to take a few moments to get the audience's feedback on today's presentation. So those of you joining live on Zoom will see a poll question come up on your screen with answer options. So if you could please click the response that reflects your thoughts. And the two responses are, I feel more knowledgeable and empowered after attending this webinar. Strongly agree, agree, neutral, disagree, or strongly agree options. So if you could pick one of those options, we'll just give you a few moments and then we will conclude today's session. Okay, thank you for completing that question. We will also be sending you an evaluation form when we email the recording and the slides. So if you're unable to access that poll question, you'll have the opportunity to share your feedback, and it really does help us to form other sessions in the future for the Arthritis Talks webinar. So we value your input. Your voice really matters more than ever in this federal election. Hot topics in the news with the election coming up. And we've joined with 12 other members of the arthritis community calling on the next government to make arthritis a priority. So take action on our election campaign and tell your candidates and party leaders that Canada needs to strengthen its healthcare system and ensure people have timely access to arthritis care and treatment they need and deserve. And once again, we are very grateful to Pfizer and our other partners for their financial support of Arthritis Talks. So this concludes tonight's Arthritis Talks. And on behalf of all of us at Arthritis Society Canada, we really want to thank you for joining us today. We hope to see you again soon and stay well. Thank you.